You know, there's a revolution happening in medicine right now, but it's not taking place in some sterile lab or a bustling operating room. Nope, it's happening inside a computer, where algorithms are learning to see diseases in a way no human ever could. So let's dive in and explore how.
And that leads to this really provocative question, one our sources are asking. We're seeing artificial intelligence that's no longer some sci-fi concept. It's here, it's now, and it's diagnosing illnesses faster and, in some cases, more accurately than human doctors. So what on earth does that mean for the future of medicine?
But before we can even begin to answer that, we really need to understand the problem that AI is trying to solve in the first place. And the honest truth is, our current healthcare systems are under an immense amount of pressure. In a lot of ways, they're at a breaking point.
I mean, just look at the cracks that are already showing in the system. We've got staff shortages, which lead to these unbelievable wait times. A study in the UK found patients waiting, on average, over 36 minutes just to get through on the phone to their doctor. And then, of course, there's the human element. Fatigue, cognitive biases, things that can lead to misdiagnoses. The whole system is just stretched incredibly thin.
And the consequences of those cracks? Well, they can be absolutely devastating. This is where the life or death importance of an early diagnosis just becomes crystal clear. When cancers like breast or colorectal are caught early, survival rates can be over 90%. But if they're found late, at an advanced stage, that number just plummets to less than 30%. The stakes literally could not be higher.
So how can AI possibly help with this? Well, it all comes down to its ability to process information on a scale that is, frankly, impossible for the human brain. It allows it to see these tiny, subtle patterns that are completely invisible to the naked eye.
The key to this is a new field with a pretty fancy name, radiogenomics. Okay, it sounds complicated, but the concept is actually pretty straightforward. It's all about teaching an AI to connect the dots between what it sees in a medical scan, the image, and the underlying genetic makeup of a disease. It's kind of like giving the AI X-ray vision for a tumor's DNA.
And this isn't just about looking at one type of scan. No, the real power comes from fusing all of this data together. The AI takes info from MRIs, PET scans, CT scans, and it combines all that with genomic data. It builds this comprehensive, multidimensional picture of a patient's health, a level of insight we've just never had before.
Okay, so this all sounds great in theory, right? But this is actually happening right now in hospitals and clinics. This isn't just theory. So let's look at how it's being deployed, because the results, they're pretty incredible.
Get this. A tool from the University of Oxford can analyze cardiac scans and help predict a person's risk of a heart attack up to a decade before it happens. I mean, just imagine that. A 10-year head start to prevent a life-threatening event.
Over in England, an AI tool called Annalise.ai is analyzing millions of chest X-rays. And the results? It's been shown to improve the diagnostic accuracy for lung cancer by a staggering 45%. Think about that. That's nearly half.
And the impact is just so broad. For pancreatic cancer, which is one of the deadliest forms, AI is detecting tumors up to 3 years earlier. For breast cancer, a Google AI is reducing the number of misdiagnoses. For skin cancer, another tool is performing on par with specialist dermatologists. I mean, the list just goes on and on.
And this amazing potential isn't just limited to cancer either. Take the fight against Alzheimer's disease. Machine learning models have shown up to 96% accuracy in early detection. That offers some real, tangible hope for slowing the progression of this absolutely devastating condition.
It's so crucial to understand this isn't just about spotting diseases more accurately. As Dr. Harpreet Sood explains, it's about making the entire system more efficient, managing cases better, making sure the right patients get referred, and standardizing the quality of care for everybody.
But with all of this incredible power comes, of course, a huge amount of responsibility. We can't talk about the promise of AI without also confronting its limitations and the very, very real ethical questions it brings up.
And this really gets to the heart of the whole thing, doesn't it? AI is a tool. A phenomenal tool for analysis. It can sift through massive data sets objectively and find patterns we would miss. But what can't it do? Well, it can't show compassion. It can't understand the unique context of a patient's life or provide that human reassurance we all need when we're facing a scary diagnosis.
And actually getting these tools into clinics is far from simple. There are massive hurdles. We're talking technical challenges, like making sure the data quality is good. There are logistical issues, especially in getting this tech to places with fewer resources. And of course, there are major ethical and legal concerns that we have to address.
I mean, think about it. What happens when you tell a perfectly healthy person they have a high risk of a disease years down the line? That can cause some serious anxiety. Then there's the risk of overdiagnosis, finding minor conditions that would never have become a real problem. And then you have the big questions. How do we protect sensitive patient data, and who is legally responsible if an algorithm makes a mistake?
Which brings us all the way back to our original question. Is AI going to replace doctors? Well, the answer from our sources is a clear, resounding no. The future isn't about replacement, it's about collaboration.
So the ideal workflow, the dream scenario, looks something like this. Step 1. The AI does the heavy lifting on the data analysis. It flags suspicious scans and prioritizes the most urgent cases. Step 2. A human expert, a radiologist, reviews those findings, applying their years of experience and clinical judgment. And finally, Step 3. The doctor sits down with the patient to discuss the results and provide that uniquely human, compassionate care.
So the crucial point here isn't that AI replaces our humanity, but that it actually enhances it. The best way to think about it is as a powerful new partner that handles the immense complexity of the data, which frees up our human healthcare professionals to focus on what they do best, caring for people.
And that leaves us with one final thought to chew on. In a future where technology plays such a vital role in our health, what does this partnership between human and machine truly look like? Maybe the question isn't whether your doctor will be human, but rather how this powerful new team will completely redefine what it means to heal.